As technology advances, the medical field finds itself at a crossroads where artificial intelligence AI holds the potential to reshape traditional practices. The integration of AI into medicine evokes a captivating vision of a future where diagnosis, treatment, and patient care may be revolutionized by algorithms that analyze data with a speed and accuracy beyond human capability. Yet, this possibility raises crucial questions about the roles that AI could assume and the responsibilities it may overshadow in the healthcare landscape. Envision a world where AI systems assist doctors in diagnosing diseases by sifting through vast quantities of patient data. By examining medical histories, genetic information, and even lifestyle choices, AI can identify patterns and present potential diagnoses. This capability not only reduces the chance of human error, but also empowers doctors to make informed decisions more efficiently. The technology draws upon vast medical databases, keeping practitioners up to date with the latest research and treatment options, enabling a level of diagnostic precision that could lead to better patient outcomes. However, the notion of AI replacing doctors entirely remains a contentious topic. Medical practitioners bring a unique blend of empathy, intuition, and ethical decision-making that machines currently cannot replicate. The human touch and ability to connect with patients, understand their emotions, and provide comfort during distressing times is fundamentally irreplaceable. While AI can enhance diagnostic accuracy and streamline administrative tasks, it cannot replicate the nuanced understanding of human experiences. Doctors play a pivotal role in interpreting complex cases, weighing ethical considerations, and fostering patient relationships that drive healing and trust. As we look towards the future, collaboration between AI and healthcare professionals emerges as a promising approach. Imagine a scenario where AI tools augment doctors' capabilities, allowing them to devote more time to patient interaction and holistic care. With AI managing routine tasks and analyzing data, healthcare providers can focus on building rapport with their patients, understanding their concerns, and tailoring treatments to individual needs. This partnership between man and machine stands as a beacon of hope, ensuring that while AI plays a significant role in healthcare, the human element, the compassion and understanding inherent in medical practice remains at the forefront. In conclusion, while AI holds immense promise in transforming the medical field, it is unlikely to completely replace doctors. Instead, it will serve as an invaluable ally in enhancing medical practice, leading to a new era of patient care where humans and machines work hand in hand to improve health outcomes and elevate the standards of care. Don't forget to like the video and subscribe the channel to get every new video. Thanks for watching.